We'll be talking on anorectal disease and bleeding. All right, basically, anorectal disease is like any disease condition that is around the anus or the rectum. So the anus and the rectum is basically the term that they collectively say that what anorectal. All right. So look at the disease and you could see that what all these disease conditions could actually what cause a bleeding. All right, in stool. All right, that's what is known as what hematochezia. Right? So anorectal disease and bleeding is what we'll be discussing. All right. So we actually have two common anorectal diseases. All right. That's the hemorrhoids which could be external or internal or prolapsing internal hemorrhoids. Okay. They will also have what anal fissures. All right. All of these could be examples of what anorectal disease or anorectal bleeding. Okay. So this anorectal disease, we get to talk about the two major ones. That's hemorrhoids and anal fissure. We'll talk about hemorrhoids. We'll talk about anal fissure. All right. So let's have the definition. So anorectal disease is like, yes, there's a disease condition in the anus and the rectum. So there are different disease conditions. It could be cancer, it could be so, but the most common one is actually what hemorrhoids and anal fissures. All right. So these are the major causes of anorectal bleeding. Hemorrhoids is the commonest, okay, but it accounts for about what 5 to 10% of acute um, lower gastrointestinal tract bleeding, hemorrhage. That's what they call LGIH. That's lower gastrointestinal hemorrhage. Okay, so bleeding is usually not massive, but it presents with bright red color. Now, let me take this time to actually differentiate between the bleeding of the upper gastrointestinal tract and the bleeding of the lower gastrointestinal tract. Okay, so now if there's bleeding in the upper gastrointestinal tract, it is up there before the blood gets to reach down. Okay, before the blood gets to reach the anus, the blood must have changed the color. The color must have been altered. All right, giving it what a dark. You like your stool will be dark. All right, but if the bleeding is just close by, close to the anus and all the stuff, right, it will be bright red. Some people call it what frank red blood. All right, so you should note the characteristics of each one of them. All right, and always ensure careful investigation to rule out other source of bleeding in patients with this condition. Right, so the thing is, we are talking about hemorrhoids and anal fissures, but it is not exclusive to them. If you have a patient with um, if you have a patient coming with bleeding in the stool, you don't just say, okay, this is only bleeding in the rectum or anus, right? You could do a total colonoscopy where you get to observe the whole colon just to rule out other possible comorbidities. All right. So these are hemorrhoids. Now let's talk about hemorrhoids. Hemorrhoids is simply like, okay, the veins around the anus, they were basically um the veins got swollen and inflamed. All right, so there's swollen and inflamed veins in the rectum and anus that cause discomfort and bleeding. All right, so hemorrhoids are usually caused by straining during bowel movement, obesity, or pregnancy. These are the commonest causes of hemorrhoids. Discomfort is a common symptom, especially during bowel movement or when sitting. All right. So other symptoms of hemorrhoids include itching, yeah, and bleeding too. All right. So a high fiber diet can be effective. That's a diet that has high fiber. Like let me say when you eat orange, you now eat plus the chaff. You eat a lot of cabbage, you eat a lot of vegetables. All those things will help to what make. Let me say you want to eat rice, you do fruit. Salad. Okay, they basically help to what make your stool very soft. All right, so there are some other drugs that are also stool softeners. You can also be taking those drugs, right? Because hemorrhoids are primarily because of straining. Your stool is hard. All right, so in some cases a medical procedure to remove the hemorrhoid may be needed just to relieve Okay, make a relief. Then anal fissures. Anal fissures is like a tear in the anus. All right. So anal fissures is a small tear in the lining of the anus. So the anal fissure may occur when passing hard or large stool. An anal fissure can cause pain and bleeding during bowel movements, right? So this condition usually heals on its own in 4 to 6 weeks. So common treatments include dietary fiber and stool softeners, as well as you rubbing creams in the affected area. Okay. So for anal fissures and hemorrhoids, I have full lectures on these two concepts already. Okay. So that's it for this, and see you guys pretty soon.